Hello and welcome to another edition of our InnovAiT podcast. My name is Sadia Ayaz and I work as a GP in Southwest London. Today's topic is a very interesting one in my view, something that again we see quite a lot of in general practice. I think we're definitely seeing much more of now. Sleep disorders. To join me today for this very interesting, I'm sure, and relevant discussion is Dr. Serena Strickland. We are going to be discussing Dr. Strickland's article from the InnovAiT journal from January 2023 on sleep disorders, in which she talks about what constitutes a healthy sleep pattern, how this varies with age, common sleep problems that we might see in general practice, how to tackle these, and what are the nuts and bolts of sleep hygiene and the sort of information we need to be telling our patients about. Serena, it's really lovely to have you. Thank you so much for joining me for today's podcast. I really look forward to our discussion. So just to give you an introduction and a background on Dr. Serena Strickland, she's currently working as a GP at Queen's Medical Centre in North Devon. She was among the first cohort to graduate from Brighton and Sussex Medical School in 2008. She has specialised in general medicine, respiratory medicine and occupational medicine before entering general practice in 2018. Her interest in sleep developed from her time in respiratory medicine and occupational medicine, and she is now experiencing firsthand the impact of disrupted sleep patterns by living with a 12-week-old baby. How is it all going, Serena? Thank you for joining us.
Thank you for inviting me. That's really kind. And yeah, certainly more aware of the impact of poor sleep at the moment with the little baby, although it is getting easier now.
I'm sure that really helps empathise with all the patients that you've seen with sleep deprivation and really how it impacts day to day.
Yeah, certainly.
It's a really interesting article that you have written on sleep disorders, and I would really like to sort of get more your first-hand take on this as well. You've covered so many important things like I've briefly mentioned. So let's start by talking a little bit more about this, and then you can also give us your personal experience and how that's all been and implementing it in day-to-day life. So you mentioned, first of all, in the article, Serena, about the importance of sleep. And actually, as some of us might know, we spend about a third of our lives asleep. So it's a very important part of what we do. Difficult sleeping, poor quality sleep and lack of sleep, as you mentioned, can impact us in so many different ways, can't it? So physical, psychological and social. And inadequate sleep, which also we will talk about, is associated with lots of comorbidities as well, such as an increased risk of cardiovascular disease, obesity and diabetes. So I'm just going to start off by talking through this scenario that you bring up in the article, which I think a lot of our listeners will be able to relate to, a typical patient who might present in general practice with problems with sleep. So the case you mentioned here is Carol, who contacts the surgery. She can't sleep, she's feeling exhausted all the time. She's a busy single mother of 3 young children and finds that she often falls asleep in the middle of the day when her children are at school. She doesn't sleep well at night and struggles to get off to sleep despite the children sleeping through the night. And when she does fall asleep, she finds it hard to wake up in the morning and set several alarms so she can get the children ready for school. She's noticed that she's getting short-tempered, emotional. She's drinking a glass of wine at night to help her sleep, but it's not really helping. And this has been going on for months and it's getting worse. She would like some medication to help her sleep. I can certainly relate to patients coming in with a similar scenario, as I'm sure others can as well. I guess the first thing I'd like us to discuss, Serena, would be what actually constitutes a normal sleep pattern. So for Carol, she's worried she's not getting enough sleep. How do we gauge how much sleep she's getting, how much sleep she needs? What does it all mean from a physiological perspective?
Well, I mean, I guess from to know whether you're getting adequate sleep, we should ask about a few questions. So first of all, are you able to wake up without an alarm? Do you feel refreshed when you wake up? And then how are you feeling in the day? So are you feeling excessive sleepiness? So in Carol's case, she's having naps in the day. She's finding it hard to sleep at night. So another thing is about how quickly people can get to sleep. So most people would fall asleep within 30 minutes. If you're falling asleep really quickly, so in less than 5 minutes or more than 30 minutes, that might suggest there's a problem with sleep as well. Other things that the experts talk about is the ability to maintain your weight. So lack of sleep can be associated with obesity because of the sleep hormones, cortisol and stress. Also kind of whether you're waking up in the night, so whether your sleep is interrupted as well. So, it can be normal to wake once or twice in the night, but if you're waking up more than 4 times in the night, that can be a sign of a problem.
And you do mention also about sleep requirements varying at different stages of life as well, isn't it? Yeah. I guess that's something important to take into account. So for adults, for example, is it sort of 7 to 9 hours of sleep that would be recommended?
Yeah, so for adults, obviously everyone is slightly different, so it's going to vary within that range, so 7 to 9. Generally the consensus is if you're having less than 6 hours, you're probably not getting enough, and if you're having more than 10 hours, you're getting too much sleep, and that can be associated with adverse outcomes, or might indicate that the quality of your sleep is inadequate.
And do you think we're generally good at knowing how much sleep we're getting? Do you think we overrate how much we sleep or underrate it? And what should we actually be doing to actually measure the sleep? Is it actually also the quantity of sleep or the quality?
It's a little bit of both. Like I said, obviously, if you're getting too little sleep or too much sleep, that can be a sign of a problem. Generally, within your sleep, you'll go through the different sleep cycles. So there's 4 cycles or 4 stages of sleep, and you might have kind of 4 to 6 cycles over the course of a night, and each cycle would last about 90 minutes with varying durations of each form of sleep. So you've got your first stage, the non-rapid eye movement sleep, which is your light sleep, dozing off. At that stage, you're quite easy to wake up, and that can last for 1 to 5 minutes. And then you've got the kind of slightly deeper sleep where it's harder to rouse you. So again, non-rapid eye movement, stage 2. During that stage, there'll be kind of slowing of your breathing and heart rate. Your muscles will relax, your body temperature will drop, and there might be short bursts of brain activity. But it's quite difficult to rouse you during that time, and that can generally be about 50% of your total sleep time. And then you move on to the kind of slow wave sleep, non-rapid eye movement, stage 3, and again, that is further relaxation of the muscles, slowing of your heart rate, body temperature will reduce. Again, very difficult to rouse. If you were doing an EEG at that stage, you would see some delta waves on there. And this stage is really important for restorative sleep and the physical recovery, and as well, like we said, about immune function. So the deep sleep is associated with that. And there's also thought to contribute to your creativity and memory. And then you've got your rapid eye movement sleep. Again, there's quite a lot of brain activity going on there at that time. So similar to when you're awake, but your body is paralysed, essentially, apart from your eye movements and muscles of breathing. So you get the rapid eye movements, hence REM, rapid eye movement sleep. This is a stage where you can have quite vivid dreams. The REM episodes will get longer as the night progresses. And it is quite essential to have your REM sleep in memory, creativity, cognition and learning. And especially in young babies, they have a lot more REM sleep compared to adults. And then in older adults and neurocognitive problems, then they can develop REM sleep disorders, and the duration of REM sleep will reduce. So obviously varies through the lifetime as well.
Thank you. That's really helpful just to get a background. And again, you do mention this also in the article in terms of the different stages of sleep. I think it's always good to really have an understanding of the normal sleep cycle, what the pattern is, to know what then is, abnormal and what needs to be done to address it. Coming back to our patient Carol, Serena, what sort of things in her history, in the busy 10 minutes that we will have in our GP lives, what are the things that we really need to elicit and find out that are going to be important for us to help manage her sleep deprivation?
Yeah. Obviously she's had this going on for a long time. It's become more of a problem as time's gone on. So it sounds like she's getting quite anxious about it as well. And that can be something we see quite commonly, that people start to get anxious about sleeping, and then they'll associate going into the bedroom with not being able to sleep. They'll get more anxious and it will become a bit more of a vicious cycle, further impacting on sleep loss. The other thing that we're seeing that quite commonly people do is rely on things like alcohol to help get to sleep. And again, that can impact on the normal sleep cycle. So although it might make you feel drowsy and feel like you're getting to sleep, you're not getting the proper sleep because you're not getting through the cycles. So I'd want to address that with her. Also explore kind of her stressors, so with her young family and things, whether there's any psychosocial support that she might have. She's already said that she wants sleeping tablets to help, but kind of explore her understanding around that and explore kind of other options and sleep hygiene, which would be really important for any consultation about sleep.
Brilliant. No, thank you. That's, again, very useful information. And I guess that can sometimes be a challenge, can't it, in 10 minutes to address so many things. Any helpful tips in how we do that? Are there any useful guidelines that can be helpful, or questionnaires that can help to, again, explore what, sort of how sleep deprived somebody might be and what sort of measures we need to be taking to address it?
Yeah. So, one thing they look at when they do sleep studies is sleep latency. So how quickly you fall asleep. And there is something called the multiple sleep latency test, where you have kind of naps throughout the day and they assess how quickly you're falling asleep, or how maybe you're not falling asleep if you're fully replete in your sleep. But that can give an idea of kind of a sleep debt, really, and how sleep deprived someone is.
What about sleep diaries, Serena? Are they helpful? And what actually constitutes keeping a sleep diary?
Yeah, that's a really good point. So yeah, sleep diaries are really important in terms of identifying pre-sleep routine, how easy someone finds it to get to sleep, how long they were asleep, and if anything happened in the night. So whether they woke up, how long they were awake for, what they did. How easy they found it to get back to sleep. And you can also ask about sleeping partners can provide information about things like snoring, any episodes of apnea, any unusual movements in sleep, sleepwalking, sleep talking, that might give you a few more pointers to what the underlying issue is, really.
Are there any investigations at this point that you think would be helpful, again, to help us make a diagnosis or exclude potential diagnoses that might be causing sleep problems?
I guess things you might want to think about is mental health problems, so anxiety, depression, post-traumatic stress, bipolar. All of these can manifest as sleep disorders, and sometimes with depression you might get the early morning waking manifesting before you get the depressive symptoms, so it can be an early indicator. So you might want to use your screening tools for anxiety and depression, for example. Thinking about things like sleep apnea, you've got the Stop Bang questionnaire, which looks at various factors, so whether they're snoring, whether they're feeling tired, whether they've been witnessed to stop breathing during their sleep, what's their blood pressure, so high blood pressure can be associated with sleep apnea, whether the BMI is over 35, age, so over 55, again, is associated with a higher risk of sleep apnea. neck circumference or collar size. So if that's more than 40 centimetres, that can be associated with it. And then the G is for gender. So sleep apnea is more common in men. So they get points for each one of those. And if it's at kind of 3 to 4 points, intermediate risk of obstructive sleep apnea, and greater than 5 points is high risk. And if you're suspecting something like sleep apnea, you would be referring on to either a sleep clinic or a respiratory clinic for further assessment, which would usually consist of overnight oximetry as a basic test. So looking for desaturations overnight.
You mentioned about insomnia being divided into acute and chronic. Acute, lasting less than 3 months, is often response of an acute event or a stressor, and then chronic insomnia lasting more than 3 months. Would that also determine how we manage patients in terms of treatment and sleep hygiene measures? I guess they do vary depending on the duration of how long the sleep problem has been there. Absolutely.
And if someone's had chronic insomnia, so they've had difficulties with sleeping for more than 3 months, it can be a lot harder to manage. Like I said, we're starting to get the anxiety associated with poor sleep and the bedroom not being a restful environment. And then you're overtired, you've developed maladaptive habits and got into a bit of a rut with it, so it can be quite hard to help people.
And how do we address anxiety, Serena, when patients do get anxious that we're not sleeping enough, even though sleep might not be that bad, but they're actually really worried? What do you advise should be told, and how should they be reassured in that respect?
Yeah, I mean, I think firstly, if the patient thinks it's a problem, then it is a problem because it's their lifestyle. And one of the definitions of insomnia is, does it have an impact on day-to-day function? And usually that's why they're coming to you, because they're struggling to stay awake in the day, or they're not functioning well. And we do know that sleep obviously impacts on cognition, concentration, memory. So it is really important. So with that anxiety, obviously the sleep hygiene advice, which I can go through in a bit more detail in a minute, but especially things like relaxation, bedtime routine, and avoiding stimulants and during the day, so things like caffeine and avoiding alcohol as well in the evenings, especially not to be used as a sleep aid. Sometimes in these cases, a very short course of the Z drugs can be helpful just to break that cycle, especially if someone's got into that kind of routine of feeling tired, going into the bedroom and then thinking, oh my goodness me, I'm not going to be able to get to sleep, and then they're hyper alert and the stress hormones are going around, whereas if they think, oh, I've got this tablet, that can help me sleep, even just for a few days to break that cycle, and then the associations with the bedroom are changing, really.
What is your take on prescribing the Z drugs that we mentioned? Because again, with often a lot of patients, they will have that expectation that we might be offered some medication. In terms of managing insomnia, whether that be acute or chronic, where should we be heading with medication? What is its role, and how long do we prescribe it for?
I think with any medication, you need to be very clear from the outset what you're trying to achieve with it, and how long you're going to prescribe it for. So the NICE guideline says kind of no more than 3 to 7 days. We know that if people are taking these medications for, say, more than 4 weeks, they develop tolerance, it's less effective, they're more likely to become addicted to it. So if they try and stop using it, they'll get withdrawal effects. So it's better to keep it to short courses. And usually say kind of not every night. So maybe if you've got a 7-day course, you might take kind of one every other night, or on the nights when you have to be rested. One of the side effects can be increased drowsiness. So I guess the first time you're taking it, you want to maybe take it when you don't have to get up early for work the next day, or you're not driving early, because although it stays in the system for just 12 hours, you don't always know how it's going to affect that individual. So just to be safe with that, avoiding alcohol with it. So yeah, in terms of prescribing them, I think if there's an acute stressful event, so for example, if it's been a bereavement that's impacting on sleep, they can be really helpful. And like I said, if you've got that chronic insomnia and you've got into a cycle of sleep anxiety, it can be really helpful to break that. But I would advocate kind of doing that alongside the sleep hygiene and support. So maybe do a short course and then review in a few weeks alongside once they've put into place the sleep hygiene advice. And you can also signpost them to there's a Sleepio app which is available on the NHS, and there's also one called Sleepful, and they both kind of do essentially CBT for insomnia but app based. So it looks at your behaviours, thoughts, and around sleep and how to address those and get a good night's sleep, really.
And would you say there is good evidence base for CBT-based therapy in sleep disorders, sleep deprivation? Yeah. Yes.
I mean, I think sleep hygiene is key for any sleep disorder, even if you've got something underlying like sleep apnea. Adhering to the sleep hygiene advice is really important. So.
And what are the main sleep hygiene rules that we should be telling our patients about? What are the key things that they should be doing or shouldn't be doing? Probably telling ourselves as well.
Yeah. I mean, I think first of all, you'd be discussing their expectations, talking a little bit about normal sleep, so how the 7 to 9 hours, and just talking a little bit about kind of preparation for sleep. So kind of winding down a couple of hours before your sleep time, avoiding caffeine after midday, avoiding alcohol in the 2 hours before sleep, avoiding heavy meals in the 2 hours before sleep, and heavy exercise. I mean, I think some people find doing things like a bit of gentle yoga before sleep might help them wind down a little bit. So pre-sleep routine, go to bed when you're sleepy, don't go too early. The sleep environment's really important, so making sure it's a comfortable temperature, so slightly cooler but not too cold. So I think the Sleep Society says that between 15 to 18 degrees, should be quiet, should be dark, so that melatonin is stimulated. Avoid having kind of clocks and things, because clock watching again can feed into the anxiety if you're waking up saying, oh, it's this time, and then you're waking up again and checking the clock all the time. Things like screens and technology can really impact on your circadian rhythms. So the light from laptops and devices and things, the blue light can be really stimulating, and that can affect the melatonin, which kind of tells your body to go to sleep. So avoiding that again at least 2 hours before bed. Or if you do absolutely have to, you can get things like blue light glasses or blue light screens to minimise that. So that can be helpful if you're absolutely not able to switch off. But again, if these devices and things can be very stimulating, so it's probably not ideal to be using them, although we accept that all of us do at some point, don't we? So talked about the sleep environment, pre-sleep. Really important is having a get up time, so keeping your waking up time exactly the same every day, even at weekends. And even if you've had kind of poor sleep, you need to make sure you're getting up at the same time. Making sure you're getting exposure to light in the morning, especially in the winter months. As GPs, it can be really difficult to do that. So just making sure you go outside for a little bit and get that light.
Absolutely,
it tells you when it's day and when it's night. Avoiding daytime naps.
Great, that's again been really useful, Serena. What's your own experience been like of managing sleep deprivation? What have you found has actually worked from this for you, and what hasn't worked? What's your sort of a personal take on it all?
Yeah, I mean, I think trying to have a set waking up time, although that doesn't always work, because sometimes you just
that's not always easy. Yeah.
I mean, taking it easy in the morning, especially. I mean, if you don't, obviously, if you're having to go to work and things, that's difficult. But I mean, making sure you set your waking up time, a couple of hours before you're due to go to work, so you've got that time to get ready and kind of gradually wake up. I think during the day, making sure you go outside, that really helps. Making sure I do some exercise at some point in the day, even just going for a walk really, really helps. And then keeping the bedroom dark and just for sleeping, not doing your work in your bed or anything.
Great. No, I'm sure that's really helpful. I'm sure a lot of people can relate to that as well. And then just winding down with the final question. Do you find, or do you think that managing sleep problems is a challenge in general practice? And if so, why do you think it is? What can we be doing better to manage our patients who come in with such presentations?
Yeah, that's a good question. I mean, it's really hard to manage, especially when people just want a quick fix of medication, and medication can help, but it's not curative. You need to work on it and kind of make changes, and that's not all going to be effective straight away. It takes time. So again, I think trying to explain that in 10 minutes is really, really tricky.
Yeah.
So I think sometimes just talk to people, get them to do a sleep diary, and then bringing them back later, and then you can look at the sleep diary together and see what might help. They might be able to identify patterns in the sleep diary as well, and then you can have that discussion about whether medication might be helpful, or medication alongside lifestyle changes for a short period, and being really clear about what you're going to achieve really and how you're going to achieve it.
Great, Serena, that's been really helpful. I've certainly learned a lot about sleep from what we have discussed, and also reading your article, which our listeners can also do on the InnovAiT website. Thank you again. You have a very busy day ahead of you, managing your 12-week-old, so I'm not going to take more of your time, but it's been a pleasure to have you and share so much expertise and your own personal experience as well on managing sleep problems. It's been really helpful. Thank you again, and we look forward to having you back for further discussions in the future as well.
Thank you.